Well, it's February and it's Heart Month, Heart Awareness Month. Of course, you should be aware of your heart 12 months out of the year, but we do give it special attention in February. So today we're going to talk about cardiac rehabilitation, something that some of you may know about, and some of you, like me, have no experience with it. So we're all going to find out about this together. So if you want to know more, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Emily Scotto. She is a physical therapist at Encompass. Good morning, Emily.
Good morning, Andrea. How you doing today?
I'm doing well, and you know what? I'm realizing in all the years that we've been doing Scan FYI and all the Februaries with Heart Month, we've not talked about cardiac rehab. So I'm glad we're going to talk about that today. But before we get into that, would you just give our audience a brief introduction to yourself and what is your role at Encompass?
So I'm a physical therapist. I'm a staff physical therapist. So what that means is I see about 7 to 8 patients a day on my regular caseload, but I also manage the cardiac program that we have here. So my role in that is that I focus specifically with the patients that come in with cardiac diagnoses, and I work on making sure that they have enough education and enough stamina to go back home.
Okay. Okay, that's the goal to go back home. So I think it's fair to say that for a lot of people, they're very familiar with physical therapy. Many of us have experienced it. But cardiac therapy, cardiac rehab is something different. And would you just explain what do we mean by that? And who would be a candidate to have cardiac rehab?
So you can think about cardiac rehab in four different levels. Level one would be the acute setting or the inpatient rehab setting, which is where I work. Level two would be an outpatient center. They're usually attached to a hospital. You would go 3 days a week, about an hour at a time. And then level three and four focus more on the maintenance programs and the home programs to ensure carryover of all the skills you learned in cardiac rehab. Basically anyone can do cardiac rehab with a cardiac diagnosis. The referral comes from your cardiologist. Generally, you'll see people with heart failure after a bypass surgery, after a valve replacement. Sometimes you'll see peripheral artery disease. It really depends on what the patients need.
All right, so it makes sense that it's someone who's had some sort of cardiac situation, for lack of a better word, a situation. But
Mhm.
now, so what does it entail if you're told that you need to have cardiac rehab? What could I expect to be doing?
So you can expect more endurance-based activities. So when you think about going to the gym, you might think about lifting weights and doing, let's say, 30 bicep curls. But instead, in cardiac rehab, instead of saying, let's do 30, it's more about intervals and pacing yourself. So it's how much can you do within a specific time frame without getting tired.
So endurance training as opposed to weight training.
So you'll still see weight training with endurance training, but it's more focused on building your endurance as opposed to strength, if that makes sense.
Okay, it does make sense. And so how am I building my endurance? Am I walking on a treadmill? What would I be doing?
So there is a lot of different options. They have stationary bikes, stationary stepping machines, upper body ergometry or an arm bike or a treadmill would be a good idea as well.
Okay, so these are things that people are familiar with if you've ever gone to any kind of a gym situation or even at home. So that brings me actually to, like a question is, as I said in the beginning, of course we need to be looking after our heart 12 months out of the year, not just in the month of February. So what are things that maybe people can consider doing in a home environment or taking with them to their own gym that is going to be specific workout for their heart?
That's a great question. So it really depends on what you've been cleared to do in terms of exercise. a good starting point for me whenever I meet someone who hasn't exercised before is I tell them start out with 2 minutes on a stationary bike and see how you feel. And then take a minute break and then do another 2 minutes and work your way up to 10 minutes, depending on how you feel.
Hmm.
So it really depends on your prior fitness level and what your goals are as well.
Right, so you're not going to go full steam ahead if you haven't exercised in many years. Obviously, like anything, you're going to start slowly. What about walking? What's your feeling about walking?
I think walking is one of the best things anybody can do for any kind of activity. And it's a great way to introduce physical activity to someone that's previously been sedentary. Again, you can start off with that 2 minutes at a time. See how you feel after you walk for 2 minutes. Take a minute break, do another 2 minutes, build your way up so you can see how you feel. But walking in general is a great exercise. It's great for your heart. It's great for weight loss. It's great for your joints.
And so, if again in a home environment, so taking a walk, and I do see a lot of, maybe this is a current trend. I bet you've seen it, Emily. People walking with these weighted vests.
Mhm.
What's the story on that? And is this worthy?
It's not something I've ever prescribed, but the logic behind it is that you're adding weight, so your body is doing more work because it's moving more weight than it's used to. People really like doing the weighted vest training. It's not something I've ever personally tried, and with the population I see, I don't know if I'd recommend it. But I do think it's a good, again, it's a starting point for someone if you want to challenge yourself a little bit more.
Okay, so I've seen people walking with ankle weights, and I've seen people putting weights even on their arms, but now I'm seeing these vests. So all right, so you're just making yourself work a little bit harder. Okay.
Correct.
I get that. I get that. Well, of course, part of the idea here is we are hoping to avoid cardiac rehab. So, what are some things that you might want to suggest to people, just generally to uh, take care of themselves? So, not that it wouldn't be lovely to see you, but the idea is to keep people away, right? So,
Absolutely.
what are some thoughts you have on this to avoid cardiac rehabilitation?
I think it starts with diet and lifestyle changes. You want to obviously reduce your sodium. You want to watch what you're eating, high protein diets, and just counting what you're eating and making sure your calories are important. And they're not just, you're not just eating just to eat. You know what I mean? It's purposeful eating. I hope that makes sense.
Yes, no, purposeful as opposed to mindless.
Correct. And then
Okay.
just overall making sure you're exercising 3 to 5 times a week. The American Heart Association recommends moderate activity every single day. I just, even if moderate activity to you is just taking a walk, just making sure you're moving every day. You're not staying on the couch all day, or you're not just getting up to go to the bathroom and then back to the couch to watch TV.
Right, that really doesn't count. Getting off the couch to walk to the bathroom doesn't count. No, I
No.
don't think so. So I think people, now you just said 30 minutes a day, 3 times a day. That seems extremely reasonable, and I'm sure that's on the low end of the spectrum of what we would reasonably expect. So other than, just walking, what are some other things that, that we could just do at home? Not everyone wants to go to a gym, but beyond walking, any other recommendations of, some general fitness things to do at home?
Sure, there's a lot of different things you could do in the house. A really good exercise that I give almost all my patients is performing sit to stands. So standing up
Ah,
and sitting down.
yes.
10 in a row. Can you do 10 in a row? Maybe you can't do 10. Let's do five. Again, take a break, do five more. That's a full body exercise when you think about it. So that's a really good way to start, is doing that. Even standing, marching at your countertop, having your hands on the counter and then bringing your knees up and down just to get that heart going, get those muscles moving.
I love that you said that. First of all, I think that something I learned years ago when I had knee surgery, they told me, leaning against your kitchen cabinet, not your cabinets, your kitchen counter, because it's sturdy, it's not going anywhere. You can put pressure on it. And that is one of the things that to this day I learned about. But if you are a couch potato sometimes in the winter, it's easy to do that. I know that. And at least during the commercials, you could do your sit to stands or
Mhm.
marching in place. So, I don't know. There's really no excuse not to do something. And 30, can you break up the 30 minutes if somebody says, oh, I don't have 30 minutes at a shot?
So it's 150 minutes per week is what they
Okay.
recommend. So you can break it up however you need to get there. Even if it's 10 minutes here, 10 minutes there, just throughout your day, you're still getting that movement. And for someone that's previously sedentary, even that's going to make a huge difference.
So you see, you don't have to have 30 minutes all in one shot. I like the
No,
idea,
definitely.
somebody you could 10, 10, 10. 3 times a day, do something for 10 minutes. When you break it down like that, Emily, it feels a lot more manageable, I think, for a lot of people. And I think one great myth is that you must do 30 minutes all in one shot.
Mhm. I would agree. I think that spreading it out throughout the day, especially for someone who might be a little intimidated about starting an exercise program, is a really great way to do it. Because, like I said, if you're not used to moving, even that little bit, like 10 minutes here, 10 minutes there, it's going to make a huge difference on how you feel. And the more you exercise, the more you want to do it.
Well, and then there's so many amazing YouTube videos now that you can honestly you can just follow along, walking in place, marching in place, dancing around the house. You can it's you can do it. You definitely, you guys, you can do this because you don't want to have to end up where cardiac rehab is not an option but a necessity. Not to take away business from Encompass or anyone else, but really the idea is that, you don't want to get to that point, right?
No, absolutely. My goal is that my patients go home and they stay home. I don't want to see anybody come back to see me. That's never my goal.
So
I
you
want
know
people
what
to be home and to keep moving.
to to get back to the cardiac rehab for a bit. So when this becomes something that you must do for your health and well-being, how much time do you typically have to invest in this kind of rehab?
That's so for the inpatient level of things, it's however long you're in the hospital. But when you get to the outpatient center, it is very intensive. It's about 3 times a week, an hour at a time, and that can go up to 36 sessions.
Oh,
So
wow.
you're looking at a long time frame. That's not always the case, but that is what I've seen and what I've learned in my practice is that it can go for a really long time. The one thing I want to drive home about cardiac rehab is the outcomes are really good if you stick with it. The retention is low because it is such a big commitment. But if you stick it out, you really do get great results.
Okay, so I think, Emily, that the point of everything is that even moderate exercise can make a tremendous difference in the quality of life. And 30 minutes a day, 10 minutes, 10 minutes, and 10 minutes is really all you need to get started. And if you can maintain that, you're in good shape, right?
I would agree. I think it's a really great starting point. And then, like I said, the more you exercise, the more you want to do it. So you'll be able to build up every day.
Definitely. And then maybe ultimately you will get to 30 minutes at a shot, and that will be awesome. That will be awesome. So, Encompass Health, Emily Scotty, she's from Encompass Health. They have 3 locations, Tinton Falls, Toms River, and Vineland. We're going to put all the contact info in the show notes if you want to reach out to them and get more information. I think that would be a great idea. And Emily, I'm so pleased that you were able to join me today.
Thank you so much for having me. It's been a great opportunity. Thank you.
A great conversation. And to our listeners, remember, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone, and bye, Emily.